You know, in the news today, I don't know if you've noticed, CNN, everybody's running with this story, and a lot of folks are asking questions. A lot has been written. A lot is being talked about today regarding coronavirus numbers that are coming out of Russia, Moscow in particular. The peculiarity of Russia is that while the case load is high, the mortality rate has remained low. There are many explanations that are being offered for this. Does it have to do with the reporting? Does it have to do with the way the healthcare system works? Does it have to do with the patients and their own natural DNA? What is it? Joining us now from Moscow is RT correspondent Yulia Shapovalova to try and help us get a better understanding of this. What are you being told there in Moscow by health officials, Yulia?
Yeah, it's probably a whole variety of things and measures, Rick, I think. Of course, the Russians have to say a big thank you to all the doctors, nurses, ambulance drivers, and all those medical workers involved for their absolutely outstanding work. What's important is that all sort of doctors, like surgeons, cardiologists, even dentists in some cases, have been called to hospitals and qualified to deal with coronavirus patients. And a quick word now about the Russian healthcare system, which is not perfect, of course, right, and we all criticize it here. But here in Russia, we have inherited this Soviet healthcare system, which used to be free of charge and oriented to absolutely all the patients, no matter rich or poor. So right now, any patient, an elderly lady, for example, with high blood pressure, can call an ambulance even 3 times a day, and it will arrive 3 or more times, and that patient will receive necessary help free of charge. So these days, people are being advised not to go to clinics in case they've developed flu or cold-like symptoms, but to call ambulance in order not to spread the virus. Yeah. Apart from that, of course, there's been a number of measures undertaken by the government. Russia had some extra time to get prepared when the pandemic began to rage in China and then in Europe. The disease came to the country, to Russia, later. So the authorities have prepared beds in all the existing hospitals, even in maternity hospitals for patients with COVID-19. Plus, new hospitals have been built or are being built right now. Even the army is involved in the construction process. Plus, officially, it's not called yes.
I'm just thinking that explanation you just gave makes so much sense, because I'm going to do a little comparison. You're in Moscow, I'm in Washington, D.C. Here in America, 47 million Americans do not have insurance. Those who have insurance don't even know what their insurance covers. Many of them are afraid because they think they're going to have to pay for things that they may not have to pay for. Therefore, in America, people do not have a relationship with their healthcare system. They don't even know who their doctor is unless they're 65 years old and on Medicare. In countries like Russia and other places in the world, you do have a relationship with your healthcare provider. I think you're onto something. I think that does make a big difference.
Well, yeah, you're right. Actually, I do know my doctors, but doesn't matter. If you have a problem, you just need to call ambulance or call your clinic, and the help will arrive. Absolutely. Obviously, we have all the widespread measures or commonplace measures like everyone in other countries has. The government has closed all the enterprises, restaurants, cafes, beauty salons, and asked people to stay home, putting restrictions on their movements. People are allowed to leave for a shop twice a week. If they walk a dog, they can do it near their house, near their apartment block, and so on. People are strictly advised to keep social distancing, and me, myself, is observing this so-called quarantine thing with my family in a remote village in the Moscow region. It feels safer here, so therefore I apologize for my internet connection, Rick.
You look great. You look fantastic, and you're doing a fantastic job, and I think this is a very instructive segment. We're so glad that you're there for us. Let me ask you a question. In Moscow, maybe unlike the United States, did they put these policies right away, and did, generally speaking, most of the populace abide by them?
Well, it's a good question, actually, because many people do criticize them, but I think all of us understand that they are absolutely necessary. And yes, people just have to they just have to obey. They just have to do what they're told to do.
Yeah, because I think that goes back to, I don't know if that's DNA, the making of different people, or the fact that we do come from the Soviet system where, you know, there were mandates. It's a different type of governance. So it's a fascinating conversation. You and I could go all day about this, and I'm glad we had this conversation. I think people learn how other people in the world are dealing with this. There she is, Yulia Shapovalova, good enough to join us from Moscow to share with us.